The city of Oviedo originated after the Civil War in 1865. The original residents came to the area and settled along the shores of Lake Jesup. The early settlers grew celery and citrus to sell to Orlando and Sanford areas. Transportation of goods was by wagon or steamships. Mail delivery was twice a week via riverboat. Oviedo is still considered to be a small country town, and a glimpse of free-roaming chickens can still be seen throughout the town. The Oviedo chickens, which have integrated into today's population, originated with the original settlers on the shores of Lake Jesup in 1825, which eventually migrated to Oviedo. The chickens add to the southern country charm of the town of Oviedo. However, the once large production of citrus and celery can now only be seen in some locals' backyards. Today, modern housing, shopping centers, parks, and areas of conservation have developed in the city of Oviedo. The city of Oviedo is mostly residential, made up of single-family homes, townhomes, and apartments. The University of Central Florida, one of the largest and fastest-growing universities in the country in Orlando, borders Oviedo to the south. The proximity of Oviedo community to UCF has led to a large growth in apartment construction to keep pace with the growth of the school. The residential neighborhoods are filled with houses that are occupied by owners and a large number of renters because the neighborhoods are located so close to the UCF campus. This also means that the majority of housing is very affordable. Government housing assistance provides low-income housing also. New apartment buildings continue to be built, with single-family residential neighborhoods again on the increase. The increased pace of construction is also due to the popularity of Oviedo, with the families moving into Florida, with most schools in Oviedo being A-rated schools, the highest rank level compared to nearby communities. Oviedo has the recreational center and several parks throughout the city. Overall, Oviedo meets the needs of the community and provides all the structured services that are in the surrounding communities. Oviedo does, however, lack a health department and a hospital. The Seminole County Health Department is the closest health department, which is located in the city of Castleberry, which borders Oviedo. I have personally observed the problem associated with the lack of a local hospital in the community with my own family member, when she fractured her hip and went to the newly opened emergency room in Oviedo. The closest hospital was 20 minutes away in Sanford, requiring transportation and delayed admission and treatment since there was not a local hospital in the community. Based on the findings from the community assessment, several population issues exist. One issue exists in racial disparity, with 82% of the population being Caucasian compared to 8.6% of the population that is black. This disproportion can easily continue and increase in existing bias and discrimination. The black population has a higher incidence of poverty, which can lead to a lack of education, which would continue to add to unemployment numbers. Joblessness leads back to poverty, which can lead to poor health, substance abuse, dependence on welfare, and high incidence of crime. These are issues that increase the risk with the population gap between Caucasians and the black population. Another population issue exists in the fact that 7.4% of the population is over 65 years of age. This increases the need for healthcare services to treat chronic illness. A hospital is not available in the Oviedo community, however, one is currently being built. Long-term care services such as nursing homes, home health, and adult daycare are abundant in the community and will become much more important sources of care to this aging group. Additionally, 12.7% population has a master's degree or higher. People with higher levels of education and higher income have lower rates of many chronic diseases compared to those with less education and lower income levels. Individuals may be more knowledgeable about the necessary preventative measures to incorporate good health, which leads to a decrease in healthcare and healthcare costs. The leading cause of death in Oviedo and other Seminole counties is heart disease. To improve the health of the community, there continues to be a need to focus on nutrition and physical activity to decrease obesity. Oviedo offers critical services in the community, which include urgent care, emergency room services, walk-in clinics, nursing homes, and general counseling and assistance services. Insurance coverage is required at some facilities, with government and community health care programs are available at other facilities. As stated earlier, the lack of a local health department and hospital in the Oviedo community creates the need for the lone emergency room and available clinics to transport patients to the neighborhood community hospitals for admission if required. There are 3 specific community objectives that apply to the health of Oviedo, utilizing resources from Healthy People 2020. Access to healthcare services. A lack of an accessible hospital in the city of Oviedo can cause a delay in treatment, and some people in the community may be reluctant to seek care. The barrier is a lack of availability, which leads to unmet health needs and delays in receiving appropriate care, inability to get preventative services. There is an immediate need to increase accessibility by building a hospital in the community. The goal is to improve access to quality healthcare services. Nutrition and weight loss is another community objective that needs to be addressed in the community. There are many fast food chain restaurants in Oviedo. To reduce chronic disease such as heart disease, it is necessary to provide the community with knowledge and skills to make healthier choices and to promote health and fitness options that are affordable and available. Heart disease is another objective and a leading cause of death in Oviedo and Seminole counties. This can also be related to an unhealthy diet and lack of exercise, which can cause increased risk for heart disease. Detection and treatment are important factors in preventing and controlling the disease. One of the controllable risk factors would be to eliminate fast food in the diet. Based on findings from the community assessment, the City of Oviedo is adequately equipped with environmental resources within the community. The Oviedo Recreation and Parks Department provides 10 parks for its community, which offers various opportunities for sport and recreation. Promoting good health, exercise, and fitness can decrease the risk for obesity and heart disease, which are 2 health-related problems in the community. The police department assists in providing a safe community. The crime rates in Oviedo community are low compared to other communities in the area. However, the city council members are concerned with an influx of crime from the Orlando metro area, which is getting closer to the Oviedo community with the rapid growth of the University of Central Florida and surrounding sections of Orange and Seminole counties in recent years. The fire department in Oviedo is responsible for all city emergency medical service and patient transport. There are 2 fire stations strategically located throughout the community. The police and fire departments provide educational programs, safety courses, and emergency management. The recycling program in Oviedo offers a free cart that has increased recycling since the start in 2014. They also provide irrigation quality, reclaimed water to their Oviedo residential and commercial customers, as well as local golf courses. The City of Oviedo employs a full-time water conservation officer to enforce water restriction requirements, as well as to educate the public on ways to conserve water. The Seminole Trail provides a safe bike path compared to a limited number of bike lanes in the Oviedo on roadways. The trail runs from parts of Orlando to the communities of Oviedo, Winter Springs, and Lake Mary. The Cross Seminole Trail links residential areas, and locals use it to get around town or for exercise. Environmental concerns pertinent to the community include being compliant with the water restrictions, encouraging recycling, and to provide more bike lanes or major roadways to provide safety and prevent injuries. The City of Oviedo is governed by mayor and 4 other members of the City Council. The City Council is responsible for establishing city policies, laws, and ordinance, managing growth, adopting the annual budget, and setting utility rates and other city service fees. The budget expenditures include city protection, staff building services, utility services, fire protection, welfare housing, and highways. The police and the fire safety in the community are accessible and efficient. Roadways are in an excellent condition. Welfare housing is easily accessible if qualified. Community information is available by the Oviedo website, and community meetings are visible online or in person and appear to be well attended. Police protection is the biggest expenditure in the city of Oviedo. Adequate police protection provides a safe community. However, is the crime rate rising in Oviedo, creating concern and need for more police protection and an increase in expenditures in the budget? The 6 community needs or problems that would be addressed by a community nurse would be: one of the greatest problems in Oviedo is the lack of acute care facility in the community. Although there are several hospitals in the surrounding communities, the growth in Oviedo and surrounding area and the current use of Oviedo emergency room demonstrates a need for a new hospital in the area. It is an important issue that the community is currently working on, with the construction of a hospital in Oviedo scheduled to open in 2017. Insufficient public transportation is another problem in the community. Currently, it takes several hours to take a bus from downtown Oviedo to downtown Orlando because it takes several bus connections to complete the route. There is a need for increased paths on roadways to decrease risk of injury. There is a high demand for homeless shelters and food pantries due to an increase in homelessness in the area. The fire department provides emergency medical service. With the increase in population experienced over the last 10 years and the projected increase in population in the next 10 years, there will be an increase in demand for all these services. As with most communities, Oviedo struggles with managing both commercial and residential development. Overdevelopment leads to an increased demand on public resources. While many have believed that overdevelopment in urban planning is a problem exclusive to the United States, many European cities suffer from the same issues. Barcelona, known for its compact planning model, has gone through a decline in the city with a surge in suburb growth, with its population density now half of that in New York City. In addition to strains on the public service system, there is an ecological strain put on the community affecting wildlife, plant, and insect species. Population overdevelopment not only affects the community financially and economically, but psychologically as well. As more undeveloped land is lost, the human species becomes detached from the calming, healing effects that natural spaces offer. The retention of undeveloped land preserved as parks or nature preserves is necessary for our long-term emotional health. While most people consider the traffic, police, fire, and school resource issues, not often considered is the ability of the health resource network to keep pace. Decisions on health promotion must be built on strong evidence. If overdevelopment continues in Oviedo, more health resources and facilities, including hospitals, need to be established within the community to be able to meet the healthcare needs of the community. The nurse can intervene by having the community be involved in the decision-making and action plan if overdevelopment continues, and there is evidence that indicates the need for the development of more healthcare services and resources that are needed in the community. This will not only involve the public health nurse and the people in the community, but also will need the involvement from various business professionals and government organizations.